Hair loss can be one of the most distressing parts of aging, and it can even begin in your early 20s, making you appear older than you really are. We asked Dr. Timothy Jochen of Desert Regional Medical Center in Palm Springs about the procedures that he performs that can restore hair loss through hair transplants.
What we do in a hair transplant is we take a strip of hair from the back of the head, because this strip or the area in the back of the head is resistant to hair loss. So we harvest that hair from the back of the head and we cut it into little pieces. And we cut it into natural follicular units, which means that the hair grows in units of 1 hair follicle, 2 hair follicles, 3 hair follicles. So we cut that strip into those little pieces, and then what we do is we take and we make little holes in the area we want to transplant the hair to. And so it's sort of like planting flowers on the top of the scalp. So we transplant those little hair follicles that we've cut into pieces and put it into the area where a patient is deficient in hair.
Dr. Jochen tells us what happens during a procedure.
When we do a hair transplant, what we do is we get the patient comfortable, and then we numb up the back of the head, we harvest that small strip of hair, and then we sew it up. Some people will staple. I like to sew because it's more comfortable for the patient if we sew as opposed to resting on staples that can be uncomfortable. And then the patient relaxes, reads a book, watches TV. Well, our tech cuts the hair strip into little pieces. Then after a couple hours, what we do is I mark the hairline and try to make a natural looking hairline for the patient, and then we start making the holes for the hair to go into. It takes approximately 2 hours for the tech to cut the graft into little pieces, and then we start placing the hairs. And the whole procedure takes anywhere from 3 to 8 hours, depending on how many hair follicles you decided to have done. For women, women typically lose hair in the central part of their scalp here, and so the grafts are always placed in this central part here. And frequently with women, what we'll do is we'll concentrate on the part in the hair, because that's where you really notice the hair loss. For men, it really depends on what their pattern of hair loss is. Typically with men, you'll see temporal wasting or temporal hair loss, and you'll also see loss in the top of the head. So oftentimes we'll concentrate on that. But everyone has a different desire. You know, some people want to change their hairline. Some people just want a little more fullness in the front. Some people really are most concerned about the hair loss in the back of their head. So we really try to tailor it to what the person wants.
We asked Dr. Jochen how many grafts are needed.
The number of grafts that you need really depends on the extent of the hair loss that you have. So somebody who has minimal hair loss would require 1,000 grafts, whereas somebody with extensive hair loss may require 3,000, 4,000 grafts. It really just depends on the extent of your hair loss and the pattern of your hair loss. After you leave the office, in 10 days we remove the sutures. During that period of time, the hair follicles may exfoliate out. It takes up to 3 months for the hair follicles that we planted in to fall out. And then regrowth starts somewhere between 3 and 6 months after the procedure.
Dr. Jochen told us about the success rate of hair transplants.
Typically with a hair transplant, around 90% of the hair follicles that we transplant survive. So there's a real high survival rate with hair transplants.